Hey, this is Eric Whiteside with Whiteside Technical Solution. Today we're going to talk about strokes. And when it comes to strokes, how can you identify a stroke, the signs and symptoms of a stroke, and what you can do to actually prevent or decrease the chances of having a stroke. So would you be able to help somebody if they're having a stroke? Would you know what to do? What is a stroke? What causes stroke? The one thing we do know is that a stroke is actually occurring in the brain. So it's different parts of the brain, but we know it's actually occurring in the brain itself. Strokes occur due to problems with the blood supply to the brain, because we know there's vessels in the brain, small vessels in the brain, and the blood supply is actually going to the brain. But if there's a blockage of some sort, that's what causes a stroke. So we know it's a medical emergency, a real medical emergency, and treatment must be sought out quickly. That's the biggest thing when it comes to a stroke. Like if you hurt your arm or leg or something of that nature, that is not a true medical emergency. But a stroke or heart attack, those are true medical emergencies. So it's best to call 911. Stroke is the fourth leading cause of death in the United States, with one person dying every 4 minutes. For Blacks or African Americans, stroke is the third leading cause of death, but is also the second leading cause of death in the world. Most common severe physical disability. So if somebody's suffering from a stroke, either on the left side or the right side, what we call the left hemisphere or the right hemisphere, they're going to have some physical disability. That's why it's important for physical therapy or occupational therapy, PT or OT, that plays a major part with rehabilitation. Approximately 800,000 have a stroke each year. That's about 1 in every 40 seconds. So 1 every 40 seconds, somebody's having a stroke. That's scary. 3 types of strokes. You have your transient ischemia attack, or we'll call that TIA. Your ischemic strokes. And you also have your hemorrhagic strokes. So for the first one, your TIA, if you notice in the diagram, this is a temporary or transit. So it's floating. So it's going to block the supply of blood to that area of the brain, but then it will eventually move out the way. So it's a temporary blockage. So you see somebody may have some facial drooping or something of that nature, then it goes back to normal. That's a TIA. Your ischemic strokes is caused by a blockage of blood vessel in the brain. So when it comes to this one, which is also known as the most common one, if you notice there's a blockage here, a coagulation of blood. So those blood cells clump together and it's stopping the flow of blood to that area. When there's a stop of flow of blood, that means there's no oxygen getting to that area. No oxygen to the area means that area will eventually die. That's the cause of a stroke. Again, this is one of your most common ones. Then you have your hemorrhagic stroke. And this one, the prefix hemo means blood. So this case, the blood vessel actually ruptures. So if you notice here, the blood vessel rupture. The easy way to understand this one is think about if you have a water hose. And with that water hose, there's a weak pressure somewhere. And then that pressure, there's a weak lining where that pressure is. And then eventually that pressure is so severe or heavy that it pushes through that weak lining, causing eruption. So that's what we're talking about. Same way you have a water hose, somebody run over a water hose, and then that area of the water hose ruptures. Same thing with a stroke. It's so much pressure in that one area of the vessel that eventually that lining can't handle it anymore, and then it ruptures. That is a hemorrhagic stroke. So your 3 strokes, TIA, ischemic, and hemorrhagic. Now for the risk factors, you have different conditions. If you have previous history of a stroke or a TIA, high blood pressure, which is also known as hypertension, high cholesterol, hyperlipidemia, cardiac disease, AFib, atrial fibrillation, diabetes, sickle cell. So these are conditions or risk factors that can help enhance or exacerbate that of a stroke. Or I should say it helps lead to that of a stroke. Your behaviors has a risk factors as well. A poor diet means you're eating a lot of fatty foods, are always going out to eat. Physical inactivity, you're a couch potato. So instead of exercising, you're just sitting in the house doing nothing. Obesity, tobacco use, and alcohol. So I shouldn't say tobacco use, tobacco abuse. So some people smoke, but when it comes to overindulging of the tobacco, that's tobacco abuse, and also alcohol abuse. Other risk factors, age, gender, heredity, race, and like we say, previous history of a stroke. So all of these are risk factors, and that can lead someone into having a stroke. So what do you do if you suspect someone's having a stroke? You must act fast. And this is an acronym, FAST. You must act fast. What we're saying is face, arm, speech, time. So again, this is an acronym for what we should look for if somebody's having a stroke. And again, yes, you must act fast. You got to call 911 if you suspect it. So when we say F for the face, we have facial drooping. Arms, can you raise both arms? Speech, is that speech slurred or is it jumbled? And time, how long does it take you to call 911? You should call immediately if you suspect someone having a stroke. So when it comes to facial drooping, one side of the face is numb or drooping, and you're looking to see if it's possible to smile. And this is one of the most common signs of a stroke. So if you take a look at the picture here, notice it's an uneven symmetry or asymmetrical asymmetry for somebody that's smiling. One side is up, the other side is down. So that's what's known as facial drooping. And that there can lead into slurred speech. Now, arm movement. As paramedics, when we arrive on scene and we're suspecting somebody having a stroke, one thing we do, we say, can you smile? So they're going to take a smile. And we know that one side is up, one side is down. So we know that could be one of the ideas or indications that suffering from a stroke. In addition to that, the arm movement. When we say raise or stick both arms out, when they stick both arms out, can they raise both of them together, or is one of those arms actually drifting apart? That's another indication of a stroke. Speech. When it comes to speech, you get them to say something, and when they're speaking, are they slurring their words? Are they able to form coherent sentences? So speech difficulty is another one. We get them to say certain words or certain sentences, and then we can actually tell if they're having a stroke or not. But one thing to be mindful, don't get that confused with somebody that's having a diabetic emergency, because if somebody's having a diabetic emergency, they will also have slurred speech as well. So be mindful of that. Time. Every second counts during a stroke. So call 911 immediately if anybody is having a stroke, or if you suspect somebody's having a stroke, call 911 immediately. It is important. We tell people time is muscle. So the longer you take, the more likely they're going to suffer irreversible damage. EMS has a crucial part in this. These EMS professionals, such as I, we're trained to respond to these medical emergencies. So once you dial 911 and you think somebody's having a stroke, we take over from there. We provide safe, quick transport, which often means quicker treatment. EMTs, emergency medical technicians, and you see the list of them, can prep the hospital for that stroke victim. From time we get on scene to the time we get in the hospital, we should be able to inform that emergency department, hey, this is what's going on. This is what you should expect. So we give them all the important vital signs so they're prepared for it. And they're going to call a stroke protocol. So we tell them what time we're actually going to arrive, so they'll be waiting for us. So it's important. If you suspect somebody having a stroke, please dial 911 immediately. The symptoms of a stroke. The length of the length of time of first noticing any symptoms is crucial to note. When did it occur? That time length can affect the hospital treatment options. The quicker you can call 911, the sooner they can get to the hospital. The sooner they can get to the hospital, the faster those treatments can occur. So it's important to be fast. Face, arms, speech, time. Sudden numbness or weakness of the face, arm, and legs. Confusion, trouble speaking or understanding, so garbled speech. Trouble seeing in one or both eyes, because again, there's pressure in the brain. If there's pressure in the brain, you could be putting pressure on the optic nerve or pressure on the blood flow to the eyes, so cause difficulty seeing. Trouble talking, walking, loss of balance or coordination. Very important, because again, you're affecting the brain, so you're affecting your coordination. Or a sudden severe headache, because again, if you have high blood pressure, having high blood pressure can cause or lead into a stroke. So it's a lot of pressure in those vessels. Now, these are additional resources for you. I'm not going to read over all of them, but these are additional resources for you if you suspect somebody's having a stroke, or just to get up to date on the different types of things you should look out for somebody having a stroke. So with that said, this is Eric Whiteside with Whiteside Tactical Solution. If you have any questions, feel free to email us at info@whitesidetacticalsolution.com, or you can visit our website, www.whitesidetacticalsolution.com. I'll see you soon.